Good afternoon, everyone. Thanks for joining us for this presentation on Next Generation NCLEX. I'm Dr. Susan Sanders, and I'm the Vice President for Kaplan. We're really glad you're here. Joining me also is Ryan Goebel, who is a member of our curriculum team. He has been really beginning to write a lot of NGN questions. So Ryan, you want to say hello?
Hi, everyone. I'm happy to be here with you. NGN is very exciting for all of us, and I'll chime in shortly and present some slides for you.
Great, thanks. And while Ryan's bringing up our slides, I just want to let you know that a couple of things. One, in the background, we have NCLEX and nursing experts, nurse educators that you may chat with, ask your questions. If the questions are of a general nature, then they'll bump them up and Ryan and I can answer them. If they're individualized, they'll respond for you and answer those for you. Additionally, a copy of this recording will be available at the end of the presentation, and we will put that link in the chat so that you'll have access to that as well. And there's a couple of websites that Kaplan has that Ryan's gonna include in the chat so that you'll be able to access our blog as well as our NGN site. So let's get started and talk about test construction and item writing with emphasis on Next Gen NCLEX. So much of what I'm going to start off with, you may have already read or heard. If you haven't been on the National Council website, I'd encourage you to do that. Sign up for their updates. That's how we get a lot of our information as well. So we're glad that that you're here, and I'm going to share that information, and then I'm going to let Ryan show you other things that we're doing at Kaplan to prepare. So Next Generation NCLEX, National Council is doing their research, and they are currently conducting those research projects to determine the ability of the innovations, and the students are taking questions to test out new types of questions to measure clinical judgment. And with that candidate participation has been extremely high, which is rather shocking. However, I believe the students probably are worried that if they don't participate, maybe they're not going to pass their NCLEX, but it's certainly not tied to that. But over the course of the 18 months, from July of 17 to December of 18, they had over 304,000 candidates that participated in the research section, and at 85 participation rate, 85%. Since then, of course, they've had many more candidates participate, but as they go through the participation, Ryan's running the slides for me here. So I'll share with you that 95 forms of tests consisting of 884 items have been assembled so that the students can take those item type for data collection. And the candidates responded to about 16 out of 20 items. And surprisingly, they only spent about a minute on each item. And you know that in general, our students have taken 72 seconds. That's about the average and what they're given for the items. So it's a little bit surprising to us that they're spending about a minute, about the same amount of time on the items. Now, when Ryan gets into the presentation, I think the question will come up: is an item one question in a case, or is it the whole case? And we never have gotten a specific answer on that, but I believe it'll be one question within the case. So we'll have some conversation about that. So a little bit of background information, which you all know, is related to factors that demand sound clinical judgment among all nurses. And that clinical judgment is necessary because of the changing landscape of healthcare, which it's ever changing. Certainly, we have increased client acuity and intensity of care. We have the aging population, not only of our patients, but our faculty. We have government regulations that are required for hospitals and healthcare agencies to meet. And that leads to that increasing demand of clinical judgment for those entry-level nurses. And then we also have seen that a substantial number of our adverse events may be prevented if there was an improvement in clinical judgment. So where did all of this begin? So I remember sitting in a national council meeting with Barbara Irwin in Portland, Oregon. You all remember Barbara as the designer of the Kaplan decision tree. And the National Council's NEC, which is their NCLEX examination committee, started talking about this in 2012. And they started thinking, is the NCLEX really measuring the right thing? Is it measuring that clinical judgment? So they started out with a strategic practice analysis pilot study to determine if the current NCLEX questions or item types could measure clinical judgment. And at that meeting in Portland, Barbara and I kind of looked at each other and said, wow, something big is coming along. And so that really made us aware that there were going to be some changes. And those changes are coming. It may take them a little while longer to get here. And we'll talk about that a little bit too. So when we think about evidence and the need for the change in the types of items for clinical judgment, when a literature review was done, we found that 50% of the errors involved novice nurses, and that's that first year nurse. And related to that, 65% of the errors were attributed to poor clinical decision making. And we also found that 20% of the employers are satisfied with clinical decision making, which means that 80% are not satisfied. And that's very impactful to us as educators. There's even more evidence to support the NGN research on the need to change the item types. The 2012 functional job analysis was RNs, and it shows how many educators, subject matter experts, and how many practice settings were evaluated. And then in 2015, the strategic job analysis still had a large number of educators, SMEs, geographic regions, et cetera. And what was identified from these two primary analyses was that the three areas needed in next generation for clinical judgment are that clinical judgment piece is extremely important. The professional communication that nurses have with their clients is important. And active listening is the third component that nurses need when they're caring for clients. And currently, you'll see on that left side, the item formats that we have now: multiple choice, multiple response, otherwise known as the select all that apply, which I call the dreaded select all that apply. We have drag and drop, we have hotspots, audio, graphics, and exhibit. And now that we're moving toward the measurement of clinical judgment, then we're looking at cue recognition. These are things that you're just going to have to incorporate and learn more about. The hypothesis generation, the communication, the consequences and risks, the task complexity, the time pressures, and the distractions and interruptions. We'll talk about how those will be measured. On the left column, you see those current types of items that National Council uses, multiple choice, etc. And across the top, you see now what needs to be measured by those item types. And you also see there's a lot of red, not much green, because those item types cannot fully and completely measure the clinical judgment domains that are needed for the clinical judgment. For instance, the multiple choice does not allow the students opportunity to recognize cues. It also doesn't include any time pressure in that multiple choice. So when you look at that, the current types of items are not measuring the clinical judgment domains that need to be done. So what the other things that National Council found for sure is that, clinical judgment is a necessary skill for novice nurses. Errors can be reduced and care can be improved with clinical judgment. Assessing the clinical judgment is a goal for NCLEX, and currently that clinical judgment is indirectly tested. And here is the National Council definition of clinical judgment. You certainly can read that. The highlighted words, it is iterative. It uses nursing knowledge to observe and assess and identify a prioritized client concern. So it's the observed outcome of critical thinking and decision making. The National Council also began sharing their clinical judgment model with us. Now, it is now known as the clinical judgment measurement model, and there are 4 layers to that. I think the important layers are 3 and 4, so I'm really going to speak to those 2 layers primarily. So layer 3 is what you've just heard about, recognizing cues, analyzing cues, etc. Those are the expected behaviors that we will see from the students, the novice nurses. Then in layer 4, what you have are the extraneous factors. All of those interruptions, all of those different things that are going on, because the students, even though they're testing, when they're delivering care, it's not in a sterile, quote unquote, sterile environment. These extraneous factors make the cases more relatable, so that as they're giving meds, they have interruptions or something happens to another client down the hall. So those are the 2 layers that I think are really an important part of the clinical judgment. And then when we look at clinical judgment related to the Kaplan decision tree, I want to show you how our decision tree really layers over and works with the measurement model. So when we're looking at the Kaplan decision tree and the student is identifying the topic of the question, they really are having to recognize cues and identify those cues based on what's going on with their client. When they're trying to identify their choice of assessment and implementation, they are analyzing those cues. So that lines up directly with the National Council model. When they move into thinking about, does Maslow apply, or are the answers physical or psychosocial, then that allows the student to determine what actions they're going to take. And then they move into the 5th step of the decision tree, which is evaluating the outcome, which is exactly the same as the 5th step of the measurement model, which is really, really important for us as educators to think about. How can we help students be able to apply that clinical judgment while answering these questions. And we believe that the Kaplan decision tree totally does that for us. So I want to talk a little bit about National Council question types. And these are the ones that that we've most recently heard about. The case study is where these clinical judgment questions start. And so you may say, what is it? Well, it's going to be through cases that are similar to unfolding scenarios that we commonly use in education today. It provides the student with a body of information or a scenario. Then it's followed by 6 related questions. And each question does test a significant element or an important element of clinical judgment. So we did hear for sure that every case will have 6 questions. So not 5, not 4, whatever, but it will be based on those 6. So you'll have your case followed by the 6 questions. And, you know, one of the things that people say to us is, where do you get your information about, Next Gen or National Council? And we get it directly from National Council. We do the research. We go to all of their meetings. We have conversations. If we have a question, we call them. So just know that what we have and what we share with you is really based on National Council. So when we look at the new item types, these are the approved ones. These are the ones that research has shown are effective in measuring clinical judgment. And Ryan's going to show you samples of these as we go through this afternoon. The close, which is a drop-down question, extended multiple response, which is that dreaded select all that apply, but it may have more options, up to 10 options. And there will be partial scoring. One of the important components to note right now is that National Council has not determined how they will score these items. Therefore, we don't know how they will score them either, but we are in communication with them, and I'll show you in a few minutes too what Kaplan's doing to prepare. The extended drag and drop, and this is a little different than the current drag and drop because not all the responses may be used. We also see enhanced hotspots and a matrix or grid type of question. And those are the types of questions that are going to be used because, as you can see by this research, those questions on the left side actually can measure recognizing cues, analyzing cues, etc., so that each of those types of items will be used for specific parts of the measurement model. The only one there is matrix is not an opportunity to select and prioritize the hypotheses. So this is a lot better at measuring clinical judgment than our previous slide. So I said how we work with a National Council to gather this information. We actually were invited to a special call for vendors on October 11th, and several of us attended. And this is the information that we found. I'll go through this. That the release of this will not be before 2023. Phil Dickinson, Dr. Phil Dickinson, the CEO there in charge of this, said that he expected it probably would be in 2023. That's the best information we have. Both RN and PN are changing. There hasn't been any research yet on PN, but you'll see in a few minutes that there will be. The test will be a mix of next gen and current NCLEX items. So all those current items are not being thrown out. It'll be a mix of those. The new items will be presented in a split screen. You'll have your case with electronic health record that will contain both relevant and irrelevant data. And then on the other side of the screen will be the actual question related to the case. And we'll demo that for you. Every case will have those 6 items, and every candidate will receive 2 to 5 cases. So that means a candidate can receive from 12 to 30 clinical judgment items. Now, this is a nuance that it's a hint, really, that the matrix items may either have one possible answer or more than one. And that'll be indicated by the type of button that is on the answer choices. Rows that contain circles indicate just one answer, whereas if it's a square, it indicates more than one possible answer. And then there was also the latest update from December of 2019. And this is where the National Council said that the special section of research would be available to PN and VN students later on this year. We also heard that there will be partial credit for all question types except those lower level knowledge questions. And that brought to mind an inquiry from us. Well, we thought all NCLEX questions were higher level, but they did say that there were some knowledge level that would be right or wrong. But again, they are still working on the methodology of scoring. And actually working with tech, creating the software to develop that scoring. So we don't know yet how exactly Kaplan will be scoring because we're waiting to hear from them. You'll see today that we have the prototypes developed that these questions can be taken. However, we won't know how to score until National Council tells us. So what's Kaplan doing to prepare for next gen? Well, we're probably scrambling as much as you are. We are busy preparing our communication, webinars like this, updates as we learn more, free faculty resources. We have an NGN website. We have a new book, a free ebook coming out for faculty in March. Early March, this will be presented. It'll be emailed as a link. It is a PDF. There aren't printed copies so that we can update it more often. But we will be sending out links for this early March. And if you are attending this webinar, you'll get a copy, a link. If you go on our blog, you can get a link. So there'll be lots of ways to obtain that link. And then I mentioned Ryan was going to put a couple of websites in the chat. This is the Nursing Educators blog, as well as the Next Generation portion site on our blog. We also are providing and preparing the ebook for students with updates, and there will be an opportunity for the students to practice NGN type questions. That hasn't been determined for sure when we'll release that. We're still working on, of course, the scoring and some of those issues related to the question types. So we want that to be ready, but that'll be a purchase that students would be taking. And it'll be it won't be a large purchase. It'll be on Amazon, but something to give them an opportunity to practice. We are developing those prototypes, and you'll start seeing some of these NGN questions sprinkled in our resources as the year goes on. We have been conducting NGN writing workshops, and we can do that for you and your faculty. You would need to just talk to your nurse consultant or your account manager if you're interested in doing that. If you're not a Kaplan customer or partner, please, you can reach out to me. Mine and Ryan's emails are going to be at the end of the presentation. Also, the decision tree, we've already talked a little bit about that. We do believe that our decision tree prepares students for clinical judgment and will help them on test day. We are conducting research to see if offering components or parts and pieces of the decision tree earlier in nursing school is effective, and how that can help students be better prepared for clinical judgment. So watch for some research on that. And we are piloting case-based lectures in a review course that allows the student to see a case, learn some content or review the content, and answer questions related to the case. So we've been using that for over a year now, and we're collecting data on that to just really refine our method of teaching NGN content. And Ryan's going to show you how you can incorporate some of these cases into your teaching as we move through the presentation today. And then we also, you may know, purchased iHuman, which is a virtual simulation product. And we have developed an undergraduate program with iHuman, and it is specifically aligned with next generation thinking. It uses the pedagogy of an electronic health record. The student has to interact with the client. They have to recognize cues, analyze cues, take actions, and evaluate their outcomes. So I'm going to do a quick run through on item writing, but I want to get through this so that you can see some of the samples that we have for you. So when we think about writing an item, an effective item is one who discriminates from students who know the material, who know the answer, from those who do not. So it discriminates understanding, it focuses on important information, and it's well written. So we're going to talk about how to write those. So the first step in writing an item is to select the objective, and it's based on a behavioral objective from the course. So we've got to be sure that we've written really good objectives for the course so that it identifies the task, the skill, or the concept. And we use blooms when we're writing these objectives. And this is a handout, a really handy handout that I like to use so that I have the words when I'm trying to write my objectives, so that I can remember, you know, whether the student needs to define or compare and contrast or whatever. So you'll have access to this when we release the recording here. The second step in writing an item is to write the stem. Writing this question stem based on the behavioral objective. And here's some hints about how the stem should be written and should not be written. Currently, the National Council does capitalize, italicize, bold the qualifying words. There should always be a client and a nurse, and they do use client now instead of patient. Some of us that are older, we flip back and forth between client and patient a lot, and the stem should contain a subject and a verb. I'm not going to read all of this to you, but just know that these are best practices in writing items. And when you write the stem, think about your wording. Now, this is kind of my sample of a bad or a poorly written item. This has way too much information for just a regular item. Now, when we get to writing cases, this is the kind of information that would be included in the case. But to clean up this item, we can go to the next slide, which says the nurse cares for the client receiving TPN. And then you see I've bolded most, and I've asked the question. These symptoms most likely indicate the following complication. And then the third step in writing items is to write the answers. Certainly write and validate the correct answer. One of the things that National Council, if you've ever written NCLEX items, which I did many years ago, you must use some current references, and they use 2. Kaplan uses 3 in general, and we compare with from curriculum specialist and expert to curriculum expert and determine how does this question look, what, before we even administer it to a student. We verify and validate the answers. And you can create distractors from errors, clinical errors, or misconceptions. And here's some hints on answer choices. And then when you're writing your distractors, again, this can be an error or a misconception. It can really provide you with information on what your student is thinking or what is their perhaps lack of knowledge, because you're going to need to analyze all of your items and the answer choices so that you can determine how well written they are, that they're not tricky, that the student's answering the question because of their knowledge, not because of the way the question is written. So our distractor table will tell you that the distractor should be realistic and plausible, should not be tricky. And so you should be able to gather some hints from that table as you're writing your distractors. So 4 easy steps, right, to writing items. I don't think any of us think they're easy to write, but these are some steps that will help you write good questions. Select your objective, write your STEM, write your answer and answers if it's a multiple select, and then write your distractors.
Hello again, everyone. I'm going to jump in now and walk through some questions, some NGN style questions. And again, here's just a recap of the item types that we know that NCSBN will be moving forward with. And Susan already covered these item types for you, the closed, the extended multiple response, etc. And so now we're going to show you some examples. Now this comes straight from NCSBN. Like Susan said, every set will have 6 questions. You can see on the left-hand side of the screen, we see a nurse's note. Now this information will remain pretty static. What will change is on the right-hand side of the screen, as the test taker progresses through the set of 6 questions, the questions on the right-hand side of the screen will change. So here's a drag and drop, and as you can see, they're only looking for the top 4 findings, so there will be 2 answer choices that will not be dragged over to that column. And so with this question, can students identify the most important information? And this is referred to as recognized cues in NCSBN's clinical judgment measurement model. The second question, this is a matrix item. And as you can see, we have boxes, not radio buttons. So there could be multiple correct responses per row, meaning that a fever could be indicative of pneumonia, UTI, or influenza. And so with this question, can the student interpret the most important information? And this is referred to as analyzed cues in the measurement model. This third question is a close item. You can see there's two sets of drop-down buttons. And so can the student synthesize important information to arrive at the client needs category? This fourth question is another matrix item, but here you see radio buttons instead of the boxes. So there will just be one correct answer per row. And here we're looking for what's indicated, what's non-essential, or what's contraindicated. And so with this question, can the student develop possible care options that are aligned with the client's needs? And this is referred to as generate solutions in the measurement model. Here we have a highlighting question, and can the student identify and perform appropriate actions? And this is referred to as take actions in that measurement model. And then lastly, you see another matrix item. And with this question, can the student determine the effectiveness of interventions? And that would be referred to as evaluate outcomes in the NCSBN's clinical judgment measurement model. And so here are some questions that we've written here at Kaplan, some NGN style questions. This is a multiple selection item. Here we see that the client has a brain tumor and diagnosed with central diabetes insipidus. We have vital signs listed, some lab values, some clinical assessment findings. And so which action does the nurse take? Select all that apply. You see that we provided 8 options instead of the standard 5 or 6 options that are currently provided on NCLEX. So the correct answers for this item is 1, 4, 5, and 7. Here we have a highlighting item. With this question, we know that the client is diagnosed with liver cirrhosis. So which findings require follow-up by the nurse? So which findings should concern the student? Here we see assessment findings or information from 24 hours ago, 12 hours ago, and current information. Well, analyzing cues, recognizing cues, the student should be concerned about the hypertension, the tachypnea. Lab values, the student should be concerned about the low red blood cell count, the low H&H, the low platelets, the hypokalemia, and the low albumin level. From the physical assessment findings, what's concerning to the student? Well, the fact that asterixis was absent 24 hours ago, 12 hours ago, and now it's present. That can indicate hepatic encephalopathy, so the student should be concerned. As the nurse, they would want to follow up on that. Of course, the diminished breath sounds and the decreasing Glasgow Coma Scale score. Here, we're not really concerned about the pupils. They're normal. It's expected for the right upper quadrant to be tender because the client has liver cirrhosis. And because the client has liver cirrhosis, it's expected that the client would have jaundiced skin and spider angiomas. So we wouldn't follow up on that immediately. Here's an example of a close item. Here in the stem, we see that it's a young adult client who reports polyuria, polydipsia, nausea and vomiting. The blood glucose is 486 milligrams per deciliter, and the client's hypotensive. So based on the client's condition, choose the most likely option for the missing information in the table below. I really like close items. And so based on reading that information, the student should be able to analyze those cues and be thinking, this client could have diabetic ketoacidosis. So what makes sense? A regular insulin infusion to lower the blood sugar, We're wanting to increase the intravascular volume. The client is pretty hypotensive, so it should be infused over 1 hour. Why is the urinalysis ordered? Well, it's to verify ketonuria because we're suspecting DKA. Which medication fits here? Well, the only antiemetic listed is ondansetron. What fits here? We have an indication. If level is less than 3.5 milliequivalents per liter or 3.5 millimoles per liter. The only thing that fits is potassium. And when would we start an infusion of IV fluids with dextrose at a rate of 250 milliliters per hour? And it's once the blood glucose drops to 250 milligrams per deciliter or 13.9 millimoles per liter. Here we have a matrix item that we've written. The client is experiencing an acute myocardial infarction. The client's had nausea, vomiting, took 3 sublingual nitroglycerin tablets. The ECG revealed ST segment elevation in leads 2, 3, and AVF, so it's an inferior MI. And we see that the client is hypotensive, 88/50, and tachycardic. So with this matrix item, we're asking what's indicated, what's non-essential, and what's contraindicated. Asking the client to rate their pain using a numeric pain rating scale, that is definitely indicated. Obtaining baseline cholesterol, HDL, LDL levels. Right here, right now, that is non-essential. What about administering metoprolol? That could be harmful for the client. That's contraindicated because the client is already hypotensive. What about preparing the client for PCI by administering alteplase, a thrombolytic medication? Well, that would be contraindicated because we don't administer a thrombolytic if the client is going to the cath lab. What about administering 4 81 milligram chewable aspirin tablets? That is definitely indicated. And determining a smoking history. Right here, right now, that is non-essential. Here we have a drag and drop item. And you see we have potential actions to take. We have conditions listed. And we're asking for the best initial action to take. So for OCD, obsessive compulsive disorder, interrupt repetitive behaviors and provide distraction. Bipolar mania, initially we want to eliminate activities that will provoke or overstimulate the client. For major depression, determining suicidal ideations. For panic attacks, slow, deep breaths. And schizophrenia, provide reality orientation. And as you can see, there were 4 actions that we didn't move over. So Susan touched upon scoring methods. NCSBN, they're still evaluating the best way to score these items. We saw this from them a while back. This is an example of kind of what they're thinking. So with this select all that apply question, if the credited answers were B, C, and D, the student would get 3 points. If they only answer B and C, they might get 2 points. If they answer correctly B and C, but then they choose F, which is an incorrect answer, a deduction could occur. So 2 minus 1 is 1. They may net 1 point. So more to come on scoring methods as NCSBN refines their scoring methodology and releases it to us.
Hey, Ryan, there's a question about the scoring maybe on that close item. Can you see that?
I'm sorry, I don't see the question.
Well, I think I can help out. It says on the close question that was just shown that there were 6 answers. Would there be partial credit, potentially 6 points from this one item? And again, we're not sure exactly how National Council is proposing to do that. To me, it would be 6 whatevers. I don't know if it'll be 6 points or 6. I don't know what the measure will be. We do know that the test will still be adaptive. So we don't know if those close items are considered a harder question or an easier question. So again, not real sure how they would be credited. One of the points that I'd like to make about what Ryan had said was that some of those matrix items are not essential, indicated, or contraindicated. I would suspect you'd be losing points if you're doing contraindicated actions. And again, don't know that for a fact, but I would suspect that that's how some of these would be graded. Ryan, anything else you want to add?
I'll just say that we know that each set will contain 6 NGN questions, but they've only released 5 NGN types that they're moving forward with. So naturally, one item type would have to repeat in the set. As regards to a ratio of how many questions for each type of question, I think the question is, so will a set possibly contain only close items or only highlight items, or will it be a mix? Will every set contain a close, a highlighting, a multiple response, a matrix, a drag and drop? We're not sure in that regards. So now let's switch gears and talk about how you can turn some of your multiple choice questions, how you can transform them into NGN style questions. So here's a very simple, straightforward 4-answer multiple choice question about hepatitis B, and it's about the transmission of hepatitis B. So think about how you could take this rather simple 4-option multiple choice question and perhaps turn it into a drag and drop item, for instance, where you have the diseases in one column, the mode of transmission in another, and how it is transmitted. You would simply drag and drop the disease to match the mode of transmission. Here's another very straightforward question. We're told that the client is in shock and that they're hypotensive. Which action is priority? So how could we take this question and turn it into an NGN style question? Here you see that we took it and we turned it into a close item. We added some more information. We didn't tell the student that the client is in shock, but they should have been able to analyze the cues, recognize the cues to determine that the client is in hypovolemic shock. Nausea, vomiting, and diarrhea for 4 days, pale skin, delayed capillary refill, history of heart failure, myocardial infarction, and hypertension that's being medically managed with furosemide, aspirin, and lisinopril. Blood pressure is 70/30. The student should be thinking hypovolemic shock. So what fits? Normal saline to increase the intravascular volume. Monitor the blood pressure every 15 minutes. The BMP was prescribed to evaluate renal function and electrolytes. Which medication or medications should be held because the client is hypotensive? And we would want to hold the furosemide, that diuretic, and the lisinopril, the ACE inhibitor. The ondansetron to treat the nausea, vomiting. And why are we auscultating breath sounds every 15 minutes? Well, we're administering fluids and the client has a history of heart failure. So we want to be auscultating for crackles to make sure that the client doesn't develop fluid volume overload. Here's another example of a multiple choice question. The LPN LVN participates in the preoperative instruction of a client scheduled for a colostomy. The LPN LVN instructs the client that 24 hours after surgery, the colostomy drainage will most likely look like which of the following? So what could you do with this question? Well, we turned it into a close item. When participating in the preoperative instruction of a client scheduled for a colostomy, the LPN LVN knows that blank hours after surgery, the colostomy drainage will most likely appear as. So this can be turned into a closed item type without the table. First, we need to work on the question. Per our knowledge of roles, the PN cannot instruct per se. That RN needs to provide that initial teaching. So we need to modify that dynamic. They still do have to be knowledgeable about the procedures and expected findings. If rewritten like this, we can ask the PN student to fill in the blanks. Now on NCLEX and some learning management systems, you will be able to put your options in a drop-down menu. If you cannot do that yet, you can still write the question and provide these possible answers in tables like this. As you can see, the second blank options are our answer choices from the initial question. Here's another one, and it's about levothyroxine. The LPN LVN suspects an order dated 36 hours ago has been transcribed incorrectly. Which action does the LPN LVN take? What is best? Here we flipped it and we turned it into a multiple selection item. We have 8 answer choices provided. And in the left-hand side of the screen, we provide the MAR and the provider orders. So the credited answers would be 1 and 2. Hold the medication until it's clarified and report to the supervising RN. This select all that apply question is about scope of practice. And so we took this question and we turned it into a drag and drop. The LPN, LVN, they can do the dressing change. A UAP, they can monitor eyes and nose. The UAP can complete a bed bath. If the UAP has been checked off on the procedure, the UAP can perform blood glucose testing as it is a standard unchanging procedure. The LPN, LVN can administer medications, but we're reserving the RN for that discharge teaching. This is a who do you see first type question. The nurse cares for clients on the postpartum unit. In what order will the nurse provide care to these clients? So who do you see first, second, third, fourth? If we wanted to change this question, transform it into an NGN style question, here's an example of what we could do. Here we've turned it into a matrix item. You see on the left-hand side, we have the same clients, but we're asking about the priority for care. Who's urgent, who must be seen first, who's important, but they can wait. They're not necessarily a priority, and which client just requires routine non-priority care. That new admit who had a vaginal birth 2 hours ago with no complications. This client is priority. Timelines are oftentimes very important on NCLEX. So we need to assess the lochia, assess the fundus. The client who requires oral pain medications, who had a vaginal birth 12 hours prior with excessive bleeding, important. The client scheduled for discharge in 1 hour, who had a cesarean birth 2 days prior with no complications. Important because this client will need thorough discharge teaching, but not our priority. And the client who needs help dressing the infant had a C-section 3 days prior. This client requires routine care. So now I'm going to turn it back over to Susan. She's going to provide you with some more information.
So I think we'll move pretty quickly through this because I want Ryan to have a chance to show you how you can design a class perhaps using a lot of this information. So, you know, when we think about how can we integrate the lab, the clinical, and the classroom to funnel down into the clinical judgment. Ryan, I'll let you just flip on through pretty quick. I'm just going to say a few words because you guys can read a good bit of this without us guiding, and certainly we're available for questions. But this gives you some examples of activities in the domain of critical thinking, clinical reasoning, and clinical judgment. And Ryan, if you'll carry on, this will show you, these tables can show you how to use this activities in the labs, clinical, and in the classroom. So critical thinking is covered here. All right. And then evaluate. Each of those components, which is going to be very important, how you're going to assess your student performance of each of those components. All right. So everybody take a deep breath. It's a lot of information. It's a lot to change. Ryan, I'm going to let you go on and show us how to incorporate in a class.
Happy to. So suggested classroom instruction. So let's now switch gears and talk about that. What I'm going to show you is the layout in our self-paced NCLEX RN review course that is live for some students. We've been collecting data on this course, like Susan said. The course incorporates case studies, essential content knowledge, critical thinking, and NCLEX style questions using our decision tree. And as you can see on this first slide, we start out with a case study. And in this instance, we start out with the S-bar technique. And so we're asking students, what are your recommendations for this client situation? And throughout, we add animations to make it a bit more interactive and also to model some of that critical thinking. Here we dive into essential nursing content knowledge about compound fractures. We discuss traction with the students. We discuss care of the client in traction. Provide some quick tips, some NCLEX tips for success. We talk about complications from a compound fracture. Compartment syndrome, remember to assess for those 6 Ps. We discuss nursing management. And we help the student to develop a plan of care. Considering the abnormal findings, what are the priority concerns for this client? Safety, worried about fat emboli syndrome, infection. We see that the client is febrile. Could they be in pain? They are tachycardic. They're restless, having difficulty sleeping. Could it be because of hypoxia? Could it be because of pain? Perhaps both. Here you see the MAR and the INO record. As I said, we incorporate NCLEX style questions throughout. So back to developing the plan of care. So the student really needs to consider additional information that's needed. Here we incorporate the recognizing cues. What is the priority for the client's care after analyzing the data? We discuss implementations, priority actions. Evaluate outcomes. After 1 hour, did it work? What needs to be readdressed, readjusted? And here, some more NCLEX style questions for practice. So that was just a brief overview of how we are beginning to incorporate case studies, essential nursing content knowledge, and NCLEX style questions into some of our presentations. So Susan, I will turn it back over to you at this time.
Thanks, Ryan. And a couple of points I want to make about particularly your slides there. You know, we don't want to bore the students with PowerPoint slides, but you guys see how we're animating those slides, trying to talk through and modeling the thinking and give the students some interactive type of input into the slides so that as we're going through those, I think that's important for all of us to remember that as we are teaching. The other thing, there was a comment, general comment that I think is important. Somebody said they were old enough to remember how we used to have cases in our nursing tests, and we taught through the use of cases. And certainly I'm with you. I do remember many of our nursing exams had cases with questions related to the case. I think that based on the research, it's showing that that's an effective method of measuring clinical judgment. So it looks like that we are moving back to that. And so let's dust off those cobwebs and remember how to write cases and evaluate and assess students on, you know, in that manner. The other thing I wanted to just mention is on the medical or the measurement model for National Council, they have continued to incorporate nursing process throughout. So don't think that nursing process is going away when we're talking about recognizing cues and analyzing cues. That is still a part of the process. The student still has to assess, they still have to plan their care. Now, National Council doesn't test nursing diagnosis, so we at Kaplan don't test nursing diagnosis, and I think you as a faculty have to decide how you're going to handle that. But do know that the nursing process is also overlaid. So not only do we have the measurement model and the decision tree, we still are talking about nursing process related there. So it's an important to note that you know, there's a lot of information here. This recording will be available. We certainly will do follow-up recordings. Ryan, if you'll go on to the next slide there. I think this is where I present a call to action for all of us as educators. Literature and research tells us that students prefer lecture and lecture capture, some sort of podcasting or recording. They want to record what we're saying so they can listen to it over and over again. So that is their preference. However, what also the research tells us is that student scores and pass rates are higher with that lecture capture plus activities. So we've got to incorporate cases and activities and thinking throughout all of our teaching methods, whether that's in lab, whether that's in clinical, or whether that's in a classroom. And I like this quote by Benner. She says that student satisfaction may not be a good indicator of learning. And I throw that in there because so many times, so much of the time, the students don't want us to flip the classroom. They don't want to be responsible for their learning. They want us to lecture to them and record it and pour it into their heads. And I know that they don't always give us great evaluations if they don't like our method of teaching, but it's been proven, the evidence is there, that it is important that we teach in the manner that we know is effective. So I would just encourage you to think about how are you teaching and provide some of this modeling of the thinking, doing the cases, flipping the classroom, however you can do that in your teaching to be more successful. And I think that'll help prepare us for NGN. And I, for one, am excited about NGN because I'm going to be the one that's going to be needing the healthcare. And I sure do want my nurses to have great clinical judgment skills. So I want us to teach in this manner. So we've given a lot of information. I see one question in the chat that I will read. It's important to test electronically. Somebody had asked about that and is curious about that. I know that all of you are wondering, well, if we do test electronically, if we're testing on computers, that Kaplan's going to be ready, but then how are you going to be ready? And you'll have to be working with your LMS, your learning management system people, your administration software to see how they are getting prepared as well. Because we'll be ready and we will help you in any way that we can. Now, the rest of the slides here are our references. So Ryan, if you want to zip through those and get to the final slide, which gives yours and my email. And thank you all so much for being here. We appreciate your participation. I appreciate the folks in chat answering the questions, our technology team that helped put this together. And let us know if you have questions or suggestions. We really appreciate you being here. Thanks and goodbye.
Thank you for your time.